Hello everyone. Today's another Q&A video. Questions about what to take after having a blood clot, questions about a Lyme disease case, and then also a question about giving magnesium to a baby. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here is, if someone is taking Coumadin after a large blood clot in the mesenteric vein, what supplements would be helpful to help prevent future episodes and or optimize health? No COVID, but the person had received 3 or 4 vaccinations. So thank you for the question. So when it comes to clot prevention, to my understanding, I have not come across any research literature looking at the non-pharmaceutical supports for clot prevention. There are certain things that I recommend to my patients and that are worked with in the functional medicine, complementary, integrative healthcare world, but to what extent they work to prevent clots, I'm not sure. Thankfully, there's lots of research literature looking at the effects of different pharmaceutical agents to help with clot prevention. So depending on the patient's case and all of that, I'm a big proponent of making sure that folks are working with, well, I shouldn't say making sure. It's really up to every individual what they put in their body, what they work with. But I generally encourage patients to work with the pharmaceutical agents that have good research literature backing up their use to give them the best odds of not having future clots. So anyways, it's question saying that there is Coumadin on board, so there's anticoagulant there, so wonderful. But just a little caveat there. In terms of additional supports over and above that, the things that I'd be looking at would be proteolytic enzymes like nattokinase, stratiopeptidase. My understanding is lumbrokinase is the strongest of all the proteolytic enzymes that we can work with, but it's just very, very expensive. It's hard to access, or can be hard to access, and so we don't usually use those. It's like, again, just ridiculously expensive, so we don't usually use that one. Sometimes fish oil can be quite helpful in that regard, and then also just looking at underlying sources of inflammation. So if a patient seems to have a lot of gut issues, well, that could be causing systemic inflammation. If they have chronic pain, well, hopefully we can address that, and that could help to reduce their chronic inflammation issues. We may want to look at doing a blood test to look at things like their highly sensitive C-reactive protein, look at their homocysteine levels, look at their oxidized LDL levels, look at their phospholipase A2 levels, and just get a better sense of what's happening with more of the inflammatory environment in their cardiovascular system, and try to get all those things on board. So kind of some lab testing, treating some root cause stuff, getting some proteolytic enzymes in there. That would be a typical approach that I would use with my patients. So thank you for the question. And moving on to the next one. So this one is a little bit of an earful, and so I'm going to paraphrase a little bit. So someone had sent, so let's see here. It says, I'm an actor. I got picked up, I think, bitten by a tick on a movie set in the mountains in April of 2023. After a year of seeing many doctors, I finally found a Lyme doctor in Switzerland. They did specialized tests. They found Borrelia burgdorferi and parasites. And so they followed a protocol, an 18-day Clark anti-parasitic cure, which I assume is in relation to Hulda Clark, but I know that she recommended very well-known, famous anti-parasitic protocols. Also, which is a herbally-based protocol, if memory serves. Also, Argentinium 23, which is a colloidal silver mix, plus neem, artemisia, boswellia, Japanese knotweed, and various detoxification products for 2 months. Then there was a second protocol that involved Japanese knotweed, cryptolepis, glutathione, and detoxification for 4 months. It says, I feel the cryptolepis makes me lethargic and dizzy all the time. I have no energy, whereas I used to be very sporty and dynamic. I feel desperate and after this horrible year and my exhaustion. I would love to know, how long does it usually take to recover from Lyme disease with plants after a year without treatment? So thank you for the question. So I guess it really kind of depends on the protocol that's being used. I'm just speaking generally here, obviously not giving any advice. I don't know the ins and outs of this person's case, obviously. Generally with when there's Lyme, it's been started to be treated within a year of onset, and there's uh, from my perspective, a comprehensive herbal approach being used. We can oftentimes see pretty fast results in the grand scheme of things. Oftentimes we'll start seeing improvement within 2 to 4 weeks of the patient being on the full dose of the protocol in question, like the full dosage of the herbs. And then, I'd say maybe on average it might take 2 to 3 months to get things on a really good path. Now, that's assuming that it's in my experience at least, the fairly rare case where Lyme's the only thing that's going on. If a patient has coexisting molds, if they have if they have co-infections, if they have pre-existing nervous system dysregulation, mitochondrial dysfunction, all these different things that were going on to some extent prior to the Lyme, then that can really extend that timeline and certainly necessitate a more fulminant protocol than just the antimicrobial herbs for Lyme. But in the case of just tick bite, bullseye rash, or not that you have to have a bullseye rash, but fatigue sets in, joint pain, that kind of thing. Patient is misdiagnosed or undiagnosed for a year. In a case like that, I would generally expect you have 2 to 4 weeks to start seeing improvement, and within 2 to 3 months would likely see a very notable, if not full, resolution of symptoms. Would be my approximate numbers from my clinical experience. So again, that's assuming a comprehensive herbal protocol. Looking at the things that are mentioned here, and again, I'm not specifically saying anything about this particular case, but the dosage really, really matters. So I've had patients who come in and they've been prescribed really good herbs, but they're on a fraction of the dose of what I would typically use to help get things on track. So sometimes the dose is too low. And then also sometimes there are certain herbs that are being worked with or substances that are being worked with that just, in my experience, don't really pack that much of a punch. Like, neem, for example, like for treating something like SIBO or intestinal parasites, great. In terms of using neem to treat Lyme, it's like, I'm not really sure how systemic neem goes. And I'm really not sure how effective that is against Lyme. Or, say Argentyn 23, which is, nothing against that product, but, the colloidal silver / silver hydrosol, which is a little bit different than colloidal silver, but I recommend, it's a 200 parts per million formula. This product called ACS 200. Argentyn 23 is 23 parts per million, so it's about 1/10 of the potency of that silver formula. Cryptolepis is a wonderful herb. Japanese knotweed is a wonderful herb. I think Artemisia, it's okay. I wouldn't put it in my top 10 list of herbs against Lyme. It's fine, but again, just really depends on the dosage. And then bringing in things like glutathione and detoxification protocols, that's all well and good. And if a person does have built-up toxins, if they have sluggish liver pathways and things like that, that stuff can be really, really helpful. But in terms of actually clearing Lyme from the body, I don't know to what extent that would actually be particularly on point. So sometimes certain treatment protocols, and again, I'm not specifically critiquing this protocol, I'm just speaking generally here, but some treatment protocols can get kind of diluted, and I'm not saying diluted, but diluted, in that it's some clinicians will say, okay, we're going to get some antimicrobials in there, but we're also going to get the detox supports in there, we're also going to get the adrenal supports in there, we're also going to get the thyroid supports in there, we're also going to get some antioxidants in there for a good measure, and sometimes that's necessary, but sometimes it's at the expense of having a strong enough treatment in any one wheelhouse. So it might be like, oh yeah, we're going to put you on some detox stuff, some Lyme stuff, whatever, but there needs to be a strong enough dose or a high enough dose of all those things to be working properly. So anyways, it comes down to dosage, having the right herbs, the right things in place, and some protocols are just not quite hitting the nail directly on the head. So anyways, I'll leave it there. If there's more specific questions on this topic, after listening to this video, please feel free to post in the comment section below. I'm running low on time here with this video, so the last question was, is it safe to give magnesium to babies? Again, I cannot specifically advise on any individual case here via social media, but I have prescribed magnesium to babies for constipation in a number of different cases, and that is something that I've done many times. Thank you for the questions. If there's any follow-up questions, just post in the comment section below. I'll do my best to answer as soon as I can.